I want to thank you for joining us here today at the 11 Alert Desk. I'm digital content producer Aspen Andrews, and I am here with Steve Carleton, Chief Clinical Officer at Porch Health. April is Alcohol Awareness Month, so I would love to discuss the importance of being smart when it comes to alcohol. And before fentanyl and many other drugs, there was alcohol. And alcohol is usually viewed as a more socially accepted type of drug, so why is it important to shine a light on this?
Yeah, great question. So alcohol is kind of it's the oldest sort of substance around, and it's important to shine a light on it because when you look at sort of the riskiness of substances, alcohol is more often the one that especially Americans find themselves getting into trouble with. Alcohol is sadly responsible for about 150,000 deaths in the U.S. per year, sort of as a direct result. So I think it's one that is socially acceptable, but it's also important just to talk about it openly and to what we're going to do today, just talk about sort of what are some healthy limits and what are some ways to bring in those limits.
Exactly, and I'd love to ask as well, is there a difference between alcohols maybe like beer and wine versus hard alcohols or liquors?
Yeah, good question to start. So when we think about alcohol consumption by type, so we think about beer, we think about wine, we think about liquor. So what we know is liquor has a much higher content of alcohol by volume, and liquor is, if you're drinking higher amounts of liquor, you're going to get intoxicated faster, and you're going to see more damaging impacts on the body as that tolerance increases and people consume more. So that being said, all alcohol is sort of dangerous. Our Surgeon General recently has come out in the past few years and said that there's no safe amount of alcohol that people drink that is healthy or has a positive impact on your body.
Yeah, I understand that. And why do you believe that people end up having issues with alcohol?
So when we think about issues with alcohol, we think about it's not just how much and how often you drink. I think in most circles, that's how people talk about it. It's, oh, well, they drink a lot, and so that means there's a problem. But that's actually not clinically how we measure it, really at all. What we measure more is, are people having a loss of control over how much and how often they drink, right? Are they experiencing a loss of control? They want to cut back, or they want to stop, and they can't do that on their own, right? They're having a lot of failed attempts, right? We think about sort of the consequences from alcohol and other drug use, right? What impacting is it having on your relationships with your loved one, with your family? What impact is it having on your ability to perform at work? And then lastly, sort of what's the riskiness? How detrimental has alcohol been to your physical and mental health, right? Like, is it leading you to sort of continuing to do it despite knowing that it's making you more anxious, more depressed? Are you taking unnecessary risks, drinking and driving when you're consuming alcohol? These are really important questions, and of course, physiological dependence is important. So having a tolerance, needing more to get the same effect, and having withdrawals when you take that substance away. Those are also sort of signs that people are heading towards having a problem.
And on that note, could you talk about what exactly it looks like when alcohol becomes an issue in someone's life, as well as what those signs are that we can look out for?
Yeah. I mean, again, sort of those signs are people start behaving in ways that they wouldn't normally behave, right? They're really struggling to stop or slow down or cut back, and it's really impacting relationships and their ability to perform and fulfill just basic obligations in life.
And is there a good way you think people can cut back if you or a loved one might be drinking too much?
Yeah, and I think this is the million-dollar question, is right. When people think about substance use and they think about alcohol use, oftentimes people think about it in a very binary way, right? I either drink and I continue on as I'm doing, or I have to stop completely. And it's really important for people to understand there's lots of other options in between those two things, right? There's lots of different strategies with slowing down, cutting back that can have positive impacts on your health, right? So thinking about switching, if liquor has been sort of the go-to substance of choice, switching over to beer or wine or something that isn't going to have quite the intoxicating effect. I think that's a win. I think people just setting limits, right, and seeing if you can hit those limits, right. When I go to this barbecue, I'm gonna have a limit of two, right. Setting limits on how many days per week you consume alcohol. All of these kind of just really practical things really help people. And then I think lastly, just looking at your access to it. How much alcohol are you keeping around in the home? Is there a way just to reduce access and having it be readily available?
And I know this can be a difficult conversation sometimes, so how do you bring up to a loved one that they might be drinking too much?
Yeah, compassionately. I think people, if you have a loved one that's struggling with alcohol, the knee-jerk reaction is to confront them in the moment, right? When everybody's been drinking or when they've been drinking too much, and that's oftentimes does not end well for people. So picking your spot, thinking about like when and where, what's the setting and situation that you're going to bring that up in, and being more mindful and deliberate about how you express your concern. I think when you do that, sort of that looks like, hey, can we go have coffee, sort of in the morning sometime, right? Using I statements, just telling them I am concerned and here's why, right? But having that conversation in one powerful moment, as opposed to sort of nagging or continually bringing it up in social situations where you know that's not ending well or leading to the intended outcome.
And are there programs available for people who might want to drink less?
Yeah, there's a ton of help and resources out there. The hardest part of it is sort of raising your hand and asking for help. But at Porchlight Health, we actually have a drinking less program that we've rolled out. And what that looks like, it's very simple. We offer medical intervention, so you can come and talk to a doctor, ask some questions medically about your drinking, and perhaps get a medication that can help with the cravings and urges and withdrawal symptoms that sort of perpetuate ongoing use. And then you can also meet with a therapist, right? And spend 4 therapy sessions just talking about your relationship with alcohol, sort of what's working, what's not working, and perhaps get some practical advice about how to cut down if that's your goal. If your goal is stopping completely, we can help facilitate sort of getting help and getting engaged in recovery on that. But our Drinking Less program right there in Colorado Springs is a great option for people.
And for people who might want some more information on this program or just on alcohol in general, where can they go?
Porchlighthealth.com is a great place to start. And if you want to call and schedule and come in, 866 MATSTAT, MATSTAT is a great number. And if you call that number, we can get you scheduled in as little as 24 to 48 hours.
Great. Well, thank you so much for taking some time out of your afternoon to talk about Porchlight Health during Alcohol Awareness Month.
My pleasure. Thanks, Aspen.